So today we're going to be preparing tooth number 30 for a full zirconia crown. Now the primary burr that we'll be using on that is the 5878K 016. This is a round-ended, it's a torpedo-shaped diamond, and it's a diamond that's very easy to get confused with the 6878K 016. They both end in that 016, those numbers. So make sure that you look at the first part of that and that you're not getting the 6878K 016, which is a chamfer diamond. It comes to a point and there's a very subtle difference between the two. Whereas this 5878K is round at the end. So make sure you look at it, make sure that you're intentionally grabbing the correct burr for the preparation. We are intentionally going to prepare this tooth with a rounded shoulder margin, and so consequently that's the burr we'll want to use. The diameter of the tip of this burr is 1 millimeter, which is perfect because that's the axial depth that we're going to want with our final preparation. Now before we start using this diamond burr, we're going to do most of our rough preparation with the 1557 carbide. And the reason for that is it's a burr that is fairly inexpensive compared to the diamonds. It cuts quickly, it cuts cool, as long as you don't clog up the burrs, the flutes, and as long as it stays fairly sharp. So they can be replaced from time to time. When we're cutting dry on typodont teeth, just be patient, go slow, go easy. Obviously in a clinical setting we'd be using lots of water to cool the burr down, but we won't be doing that today. The objective is the same, but the preparation techniques are just a little bit different. So before you start doing anything to the tooth itself, the very first thing you're going to check, and you would do this with any tooth preparation, and that I'm going to swing around this way so that you can see there. But we're going to look at the occlusion. We're going to look at how those upper and lower teeth interact to make sure that that our occlusal design, the occlusal clearance that we provide with our preparation, is appropriate. And because this is a nice class 1 occlusion where the cusp and fossa they interdigitate well, we're going to be following pretty much the anatomy of the tooth, but we're going to be checking clearance with tooth number 3 up on top. And so there's no gaps anywhere that are strange that would make us think, well, I can take a little bit less off in that area. We're going to have a fairly straightforward preparation from that standpoint. So let's get started. I have the 1557 burr in. That's a crosscut Fisher burr again. And the very first thing that I want to do is just break those proximal contacts, get that part out of the way, and then I can focus on the preparation quite clearly. And to break proximal contacts for this particular tooth, it's a little bit easier, and I hope I don't mess things up for our camera people here too much. We're going to go up just a little bit, but it's a little bit easier for me to come out to the 9 o'clock, maybe even the 8 o'clock position, and come from the side. And that way I can very directly look at my proximal surfaces as I'm breaking contact so that I don't nick or scrape the adjacent teeth when we do that. So I can get my feet and hands in the right place and get my lamp on, which I hope doesn't interfere with your lighting there. When you do this, you want to angle the tip of your 1557 burr toward the gingival embrasure. So you're going to be making just little brush strokes. It's a good idea to keep a little bit of tooth structure between you and the adjacent tooth. You don't have to have this right up against that adjacent tooth. Kind of like that. And we're again trying to angle that burr kind of down into that embrasure so we don't leave a big ledge down by the gum line. So we've broken contact on the distal, and we'll now move to the mesial. And same thing, we'll tip the opposite way so that the tip of that burr kind of tries to come through into that gingival embrasure. We'll try to keep a little tooth structure between us and that adjacent tooth. The other thing that's very easy to happen on these typodonts is for you to drop too close to the gum line too quickly, and obviously with these typodont preparations we have to keep everything super gingival. Our target for distance from the gum line is going to be 0.5 millimeters super gingival. And so if we're in that 0.5 to 0.75, that's about right. Now clinically, we go subgingival sometimes, and that's dictated by a whole bunch of different things, which is a subject for another discussion. So once we've broken contact, now we're in a good position to start on our occlusal reduction. I will do that with guide cuts, and so I'm going to start with my functional cusp bevel guide cuts. And before we do this, let's just review. For this all zirconia, and this particular preparation would work with any ceramic. So if you wanted to use lithium disilicate here, you could, but you'd probably want to bond it for strength. Zirconia, on the other hand, doesn't require that. But this particular preparation design can be used with pretty much any ceramic that you'd use in the posterior area of the mouth. The occlusal clearance that we're looking for on all of the occlusal surface, so clear from the functional cusp bevel, the functional cusp, and the non-functional cusp, is 1.5 to 2 millimeters. With your guide cuts, you want to stay a little shallow so that when you do your refining with the diamond later, you don't over-reduce occlusally. So the idea behind the guide cuts, this burr is 1 millimeter in diameter, and so I know that I need to be a little deeper than that, but I'm going to start with that as a guide, because the purpose of the occlusal reduction is to simply take that occlusal surface of the tooth and reduce it geometrically, following the anatomy of the tooth. It will be rather angular, but it will follow the anatomy pretty much of the tooth we're preparing with respect to the anatomy of the opposing tooth, so that we get the proper clearances and we don't have thin areas. So 1.5 to 2 is our overall target. With these guide cuts, I'm going to keep them very close to 1 for now. I can always go a little deeper. So we'll start with our functional cusp bevel, because that's easy to get to. That is lined up. It's basically at the same angle that we would use for our non-functional cusp reduction. It's just brought out to the buccal cusp here on this particular tooth. So I'm going to turn my handpiece around. I'm going to start with that buccal groove, and I'll do a guide cut there, and then I'm going to come to the cusp tip, so basically where that opposing triangular ridge would meet up, and then I'm going to start on this cusp, and then I'm going to go back to the distal buccal groove, like that. And then I'll move in. Now I'm going to switch by the camera here, but I'm going to move in and now do these guide cuts on the functional cusp itself. So these guide cuts are going to be in the grooves and on triangular ridges, and then we'll connect them. Right there, it's going to be a little bit distal to the buccal groove. A triangular ridge right here. These change angle. The triangular ridges are steeper than the grooves, and so you want to change the angulation of your burr with that. And then we'll go back and do this. I'm trying to make it so I can prepare and still not block the view of the camera. We're going to do this distal lingual cusp. We left one of the grooves undone on the functional cusp, so we'll come back and finish that. And connect those grooves. I'm starting to get a little dull on my burr, but we're still okay. So there are my guide cuts now. And the next step is just to connect the guide cuts. And so we'll do that next. Now we'll move into and I don't need that burr quite so long here, so I'll move it back in, and we'll move to the functional cusp. And then over to our non-functional cusp. At this stage, it's okay if your preparation is a little bit rough. You're just trying to keep the basic geometry of your occlusal reduction and occlusal clearance in order. So at this point, let's check our occlusion and see how we're doing. So we'll have our patient close, and we'll be able to identify areas. Now we start to check clearance and how this tooth preparation is interacting with the opposing occlusion. And we want to mirror the shape of the opposing tooth. So I can tell, for instance, that my clearance is fairly uniform except right opposing this triangular ridge right here on the mesiobuccal cusp of 3. So I want to deepen that just a little bit. And the way to do that is to have the patient close. We're going to extend this burr just a little bit like we did before. The functional cusp bevel is nice because we can view it directly. The functional cusp and the non-functional cusp we have to be a little more clever with, and we'll get to those shortly. But we'll refine this a little bit. That's where that buccal groove is going to be for the most part. And we're getting a little closer now. So we're probably just a little over 1, which is where I would like to be at this stage. So let's come back now, and we'll put our burr back into the handpiece a little bit better. And now we're going to start refining actually with the diamond. So let's move to that 016, but the torpedo-shaped diamond, 5857, 016. And get our suction over here. Again, we're trying to maintain the anatomical form in our occlusal reduction, so that the restorative material can be a relatively uniform thickness, which improves its durability, and it makes it a lot easier for our laboratory technicians also. So now it's about time to check our clearance. So I'm going to swing around again to this 9 o'clock position. We'll have the patient closed together, and we're looking at this red measuring stick is 1.5 in diameter, and so we want this to just fit, and it is. If we were to get this blue stick, which is 2 millimeters in diameter, to fit, we'd be over reduced, and so it's binding, which we want it to do. It fits in some places, but it doesn't fit in others. If this easily fit through, I would be a little bit over reduced. So again, going back to the red, that fits in there nicely with just a little wiggle room. The way this is designed, this end, is to now come up over the top and check the functional cusp reduction. It looks like we're good there. And then try to come out the non-functional side without having it bind up on us too much. And it looks like it's doing that. This is designed to come around from the distal the same way. And although it's not a perfect measuring device because this is such an irregular shape, it's close. And this is binding a little right at the distal, so that tells me that right back here by the distal lingual cusp, I'm a little bit under reduced. So we're going to take a little bit more off there, check that, and then we'll start on our axial reduction. All right, we'll check that again. And I'm going to come off to the side here because I can do that a little bit better. And that seems to wiggle through there a little bit more easily now. So we're getting pretty close. Let's move on to our axial reduction. Now, one of the biggest errors that we see, especially early on as you're learning to do crown preparations, is getting the axis of the preparation right. On these lower molars, because of the curve of Wilson, they are slightly inclined to the lingual. And so it's important that we keep the axis of the preparation on a lower molar like this a little bit lingual oriented, which is the axis of the tooth. We can key off of adjacent teeth because they're lined up in the same fashion. So the first axial wall that we prepare is the buccal axial wall. It's easy to get to, it's easy to see. And if we line that one up correctly, then we key off of that for all of the other axial walls. So I'm going to first line up my handpiece, and then we'll start the axial wall reduction on the buccal. So if I key off of the adjacent tooth, so number 31, that is about parallel with the long axis of that. And if I move that to the buccal without changing the angulation as much as possible of number 30, and you can always, if you get a little bit lost and you don't want to make a big mistake there, go back and check it. Line your handpiece up again. So we're going to continue to prepare in axially. Now, I recommend that as you're doing your axial wall preparation that you go in and apical as you're doing it. If you put your handpiece 0.5 millimeter supragingival, in other words, the tip of the diamond, 0.5 millimeter supragingival, and prepare in axially a millimeter, you will be subgingival by the time you're done. So you want to be going both directions, axially and apically at the same time, so that when you are 1 millimeters of axial reduction, you end up being 0.5 millimeter supragingival. So now that I've kind of lined up that axial wall with the axis of the tooth, now I can come out here and view the gingival aspect so that I don't over-reduce, and continue with that axial wall reduction. And so I'm going to try to blend this with the interproximal. It's real easy to get what's called a J-lip, or a little ski jump at the margin with these. So be careful not to do that. Scanners hate them, and you'll end up with an open margin if you do a J-lip margin. As you approach the adjacent tooth proximal surface, always keep one eye on that so that you don't nick the tooth or scrape it. So I'm going to now start to move a little bit interproximal on the distal. Sometimes students will get a little timid in this area and leave the margin quite supergingival, but it's actually easier to take it a little closer to the gingiva because the tooth gets further and further away from the adjacent tooth. So we'll do the same thing on the mesial. Again, keeping one eye at all times on that adjacent tooth. Okay, now we can come back to our axial, kind of an overhead view here from the occlusal. Make certain that we haven't changed our axis in the process, and I have a little bit. I've tipped it out to the buckle, so I'm going to refine that now. And that's why it's a good idea to just view these from multiple vantage points. You get a little focus on the margin area, and then your axial wall suffers, and vice versa. So that's starting to come back into alignment a little bit better. And now we'll just we'll try to refine that. So I want to get a mirror view at this point and look down on the tooth to see that I'm starting to get a uniform 1 millimeter. Again, the tip of this burr is 1 millimeter, so if it sits on that rounded shoulder, it's your depth is just right. So let's swing back out here again. I think what I'll do, I may leave that off for just a minute so I can get a little steadier here, because I'm refining the margins now. And these axial walls. So I'm a little shallow right there axially. This stall out speed is just a real handy speed, both clinically and on a typodont, where I'm just kind of going slow and easy, and I'm just sanding and shaping the preparation. So let's see how we're doing now. I'm going to try to get out of the way here again. I'm going to look down on our axial walls. I've got a little bit of a rough spot where my margin changes direction right there. And you can see that when you're looking straight down. So I'm checking the form and flow of the margin. We want to get those as smooth as possible. And that's better. That just took out that little bit of an irregularity. So now that we have the buccal axial wall finished, it's going in the right direction. The depth is good. We're about the right amount supergingivally. We've gone interproximally. We can do the lingual axial wall. And so we'll key off of our buccal axial wall. Hold the handpiece out here, put the burr up against that axial wall, and then simply keeping it parallel, move to the lingual of the tooth. And then check from time to time if we need to line things up a little bit. Come back. Don't get too focused on your preparation that you forget to just check your bearings from time to time. And we're getting close on our axial depth. One of the most difficult things to do with these is blending. So we've worked on the buccal, we've worked interproximally, and now we're working on the lingual axial reduction. The line angles get neglected sometimes, and we don't blend the form and flow of our margins and our axial wall reduction well at the line angle. So take a little time so that you bring all those margins together as you're going around the tooth, so that they're of a uniform depth axially, and so that your margin has a nice form and flow all the way around the tooth. And that takes a little bit of time to do. The most difficult one by far is the distal lingual. And so the way I like to line those up is I'll finish with my interproximal reduction, and then I'll finish with my lingual reduction, and then I'll look at the two and see how they're lining up, and see if I need to bring one up a little or one down a little, or the other one. You can't bring them up. Once you've cut them, they're gone. But you need to alter one or the other, the one that's high, the one that's occlusal, so that it flows into the one that is more apical. So I'm going to do that next, and we'll look at that. And they're pretty close on the gingival height, really, really close. So I just need to blend my axial reduction a little bit more and make sure that that is appropriate. I'm going to come out here and make sure that I've got a good angle here. And that's blended together. The mesial lingual needs a little attention. So we'll it looks like we are pretty close all the way around. We've got I've got a little irregularity when I look at my lingual margin that way, so I'm going to try to smooth that out some. It's always a good idea to keep your margins on these typodont preparations especially a little bit super gingival, because you can always come back and take a little more off if you need to, but it's pretty tough to add. And that's better. That's better that way. The only error that I can see that I've made where I've over reduced is right near the distal lingual. There's a part, and this will happens to all of us, where my axial depth is a little more than 1. And so what do you do when that happens? Well, you leave it alone, and just make sure that everything else is as close to the criteria as you can get. So we finished our axial wall reduction. The only part of this preparation, there's 2 parts that are left. The next is very, very easy, and it's the non-functional cusp bevel. And so what that does is it gets rid of the acute angle that is formed between the non-functional cusp occlusal reduction and the lingual axial wall. That's a very sharp angle, and if that's left there, it's difficult with the laboratory processes that follow to reproduce that. It's an easy place for bubbles to form both in the impression, the stone, and on and on. So we'll put the functional cusp bevel on that. That is about 1 millimeter wide all the way along, and then the final step will be to round the line and point angles for this preparation. Now with zirconia, you truly do not have to round line and point angles. The material is strong enough that it's okay not to. But keep in mind, this preparation is a design that is suitable for both zirconia and lithium disilicate. That being the case, you definitely need to round the line and point angles. So we will do that as the final step. So let's do our non-functional cusp bevel, and that simply bisects that angle that we spoke of on the lingual aspect and bevels it. And it's about 1 millimeter in width, and then we'll round it too when we're all done. And so that is what our preparation is going to look like. Yep. So if this were zirconia, we could stop at this point. The preparation is basically finished. There's a few sharp edges that I would want to soften a little bit. And softening is different than rounding. Softening is just getting rid of a real sharp angle that is made when you prepare a tooth with a diamond burr. Rounding, on the other hand, is we're rounding those line angles, and that's what we're going to do because we want to make this preparation suitable for a glass ceramic like lithium disilicate. So we'll go ahead and begin the rounding process, and it's just a process of taking the handpiece on stall out and just taking those line angles, and handpiece doesn't want to stall very well. It wants to go fast or slow. I'm sure that none of your handpieces ever do that, just mine. That's rounding is just going over those angles like that. I'm going to come out to the 9 o'clock position here. The most notorious areas for having a sharp spot are the marginal ridges, but even the tips of these cusps can be problematic. I find that with rounding, you want to look at your preparation from multiple angles too to make sure that you've gotten it appropriately rounded. And I can see a sharp spot right there. So again, we'll want to look at this from all different angles. And we're still a little bit sharp, these cusp tips here, just a little bit for some of the softer ceramics. And it looks like we are there.